Hello, I am Dr. Rohit Deshmukh, consultant psychiatrist practicing in Mumbai. In last topic we discussed about mental illnesses. Today we will be discussing about the medical management of those illnesses and what are the myths around these medicines. So let's begin. So first myth around the psychiatric medication is that these medications can change your personality. So let me tell you, none of the medication on this earth can change anybody's personality. These medications are designed in a certain manner that they can manage your brain chemicals and help you be better in the situations where you are finding yourself very difficult. These medicines do nothing more than balancing your brain chemicals, which are actually needed for our behavior in a particular setting or in a particular situation. The second myth is all these medications will make you sleep. So no, all these medications doesn't induce sleep or anything like that. Yes, few of the medications which are actually used to induce sleep, to make you feel better, to help you sleep better, can induce sleep, which belong to benzodiazepines category. The other medications, the newer antidepressants like SSRI, SNRI, in fact help you stay awake, stay fresh, stay energetic throughout your day. The third myth around this is all these medications are highly addictive and you cannot live without them once you start them. So this is not at all true, because these medications do not alter your brain chemistry to that extent that you will have withdrawal symptoms or you will have tolerance to these medications. These medications are given just to support you in your difficult time, and once your illness gets better, we can easily taper them off. The other myth around this medication is that once you feel better, you can stop it abruptly. Never do that, because stopping these medications abruptly might have initial withdrawal symptoms. These initial withdrawal symptoms might make you feel difficult and very uncomfortable, that you will land up in something other than the mental illness. You might land up in a medical situation if you stop them abruptly. So leave it to your psychiatrist, they will taper it off gradually and you will be off medications soon. The other myth around this medication is these medications generally are required for lifelong. But again, this is false. Few of the illnesses in psychiatry are chronic illnesses like schizophrenia, bipolar disorder, sometimes major depressive disorder. This kind of disorders are chronic illnesses and they tend to stay with you throughout your life, and in such cases these medications might be required for a lifelong. In other cases, in small illnesses like anxiety, depression, phobia, so in these illnesses you won't require medication lifelong, but yes, in some cases it might stretch longer to like 1.5 years, and then they can be stopped. The other myth around this medication is that if you require the medication, that means you are weak. No, you are not weak. Few of the illnesses can only be treated with the medications and not only therapy. Yes, combination of medicine and therapy will definitely help, but without medications, few of the illnesses you cannot treat and you will be in a loop of therapy and your illness, and it will never end. So please trust your doctor for the medication part and go ahead with whatever is being prescribed. The next myth in this medication part is medications will fix everything. So again, this is not true, because medications, like I said, will only support you. Once you have that support, you have to work on yourself. It's like the plaster that we put whenever our bone is fractured. If you are not taking the medication, there is no plaster around the bone, and without that the bone cannot heal. Medicines help in a similar manner. In many cases, medicine just act as a support so that you can heal. Once you learn this healthy pattern, then you won't require medications anymore and we can pull them off or taper them off gradually. The next myth is the medications are like crutches. So no, they are like support but not crutches, because support is something which you require very temporarily. With the help of this support, you can get better. So don't treat your medicines as crutches, because that will further reduce your confidence and slow down the process of healing. So treat these medications as like any other medications that you take for your physical illnesses. If you have fever, you take paracetamol very easily. But I would say paracetamol is 500 times more dangerous to your liver than our antidepressants. One more common myth around this medication is medications are the last resort. So it's not true. Medications in some illnesses, like I said, the few of our chronic illnesses like schizophrenia, bipolar disorder, where the person is irritable, there is anger outbursts, they can hit somebody, their medications are utmost required. But in mild illnesses like anxiety, phobia, we can go ahead with the therapy first, and if required we can introduce medications later on. So medications are not the last resort, they are like support, and they can go parallel with the therapy. And I would like to make one more thing very clear: whenever you are suffering from any mental illness, please do consult a psychiatrist first, then go for the therapy, because going for the therapy directly is like going for the physiotherapy when you have a severe fracture in your bone without consulting an orthopedician. So if you can do that, you can do even this. So please try to avoid that, because that is not the right way. You have to go to a doctor first to analyze the situation, get the management plan, and go ahead with the thing. Thank you.